Good.
Hey
Good
guys,
evening. Yeah, go ahead, Raju.
hi Deepak. Hey guys, hi. Um, Welcome to another Sunday of workshop from Blue Circle Diabetes Foundation. Um, Today we are going to talk about Halt diabetes, or in fact, we are going to talk about pre-diabetes, where our main focus point would be on remission and remediation of pre-diabetes. I'm joined with my colleague, Mr. Deepak Shukla. He's a type 2 diabetic, and I will allow Deepak to introduce himself. Over to you, Deepak.
Yeah, good evening, guys. So, जैसे कि आप we are and live of the Blue Circle workshops. So these workshop we conduct regularly by the patient-led community. As पता है, like Blue Circle is a patient-led community where we discuss how we can manage diabetes, basically of type 1, type 2, or any concerns of the diabetes. And इस group में like we share the queries and our fellow people like who are in the member of the group. So like we feel glad to answer the queries. And talking about today, so we will be presenting today's topic, that is pre-diabetes. And I, Deepak, and Rajiv will be taking this conversation ahead. So we have prepared a deck of slides with the information which we had, and we request you, if you want to add something, you can add your queries in chat or questions, and after that we can carry this conversation ahead. Yeah, over to you, Rajiv.
Thanks, Deepak. Um, guys, let's start with the presentation. My name is Rajiv here. I live in Bombay, and I've been born and brought up in Bombay. I'm type 2 diabetic since the past 13 years. So, to begin with, let's talk about. We all know what diabetes is. I mean, diabetes is such a beautiful disease that no one needs an introduction. But let's talk about what exactly is pre-diabetes. So, moving on to the next slide.
Yeah, we can discuss it, like let's say uh,
Yeah.
basically like let's say diabetes, like hearing about the word diabetes is very, first of all, whoever get it, it's very scary. But when we when it when we can like predict it before the complication or before reaching it to the diabetic stage, so that will be very helpful. So we have tried to get the pointers which can help us to track like who are at the risk of the pre-diabetes, and if you are detected with pre-diabetes, how we can go with go with taking care of that, so that we can control it at that stage only. So yeah.
Right. So basically, pre-diabetes is a stage where it's a stage before diabetes. So normally it's a middle level or the middle layer between diabetes and a normal state of a human being of health. So what happens is that when a normal person, if that person starts consuming or probably loses control on his blood sugar levels, for then what happens is that that person in a slow as time goes, that person enters into a stage of pre-diabetes. So when that person enters into in this stage of pre-diabetes, that person never comes to know actually, because it's a very mild stage, and it usually goes undetected until and unless the person starts experiencing symptoms, and those symptoms are like normally the person would start feeling thirsty, or maybe he or she feels like urinating a lot of time, blurry vision, always feels very tired, or maybe some persons experience weight loss, which is a very common thing nowadays. So what do you think about this, Deepak? I mean, these symptoms are very common nowadays. I mean, especially weight loss.
Yes, Raju. So basically, talking about type 2 diabetes. So let's say whenever like it happens because of few reasons. Like let's say whenever a person stress level, जब आपका stress level बढ़ जाएगा या फिर you are in some job जिसमें आपका physical activity कम हो, like let's say you require more of desk work and less physical activities. So these factors combine it, and let's say we have a busy schedule and we miss everything. Like let's say if you are feeling tired, so आपको लगेगा कि आप क्योंकि आप दिन में बहुत सारा काम कर रहे हो तो आप टायर्ड हो. Same
Right.
similarly, like let's say, yeah, like you will feel less of energy, but you will not able to relate that it's related to the pre-diabetes event.
And
So
I think Deepak, also it
yeah, go ahead.
sorry to interrupt you. What I wanted to add is pre-diabetes also happens if a person is following an unhealthy lifestyle. Say, for example, drinking, smoking, or maybe the person is eating a lot of unhealthy foods, due to which he has become very obese and वो मोटा हो गया है. And because of obesity, the body is not able to cope up with the food that he or she is eating, and then eventually the body gives up. So what happens is that when the person goes on eating unhealthy food, like for example fried foods or spicy foods or refined foods or ultra refined foods, especially nowadays, foods like burger, pizza, and especially fried food like vada pav, and anything which is unhealthy. So, and also the pattern of eating. So if you're supposed to have breakfast in the morning, and if you're gonna eat it like a lunch, then obviously it is not going to help you at all. Some people eat as if they have never eaten. So, and especially the lifestyle, and yeah, and the most important thing is that the person, there is no activity in the body. I mean, the body is not moving, it is just sitting in one place, and you're just hogging the food day in and day out. So,
Yes,
I think these are the causes of pre-diabetes.
yes, these are the causes, and let's say like who are at the risk. So as already say that, like already said that if you have a sedentary lifestyle, that is the one factor. और अगर आप like let's say आपके heredity में है, like if your grandmother is having diabetes, your mother father is having diabetes, so you should be aware that like you should take care of that symptoms as a test point. And अगर आपको ऐसा कुछ दिखता है कि आपका एनर्जी लेवल अचानक डाउन हो गया, तो आपको बेसिकली टेस्ट लाइक you can go ahead and have a test that if it is a pre uh, pre symptoms of diabetes or not.
Yeah,
So yeah, like as the word indicates pre-diabetes, it is pre-diabetic, but uh, how we can diagnose it. So it is it is like we have to be aware of our blood sugar level and other body things,
right.
so that will help us. So going like before going forward, like we have audience basically. Suresh and Snehal has pinged good evening to us. So very good evening and thank you for joining the conversation. And yeah, let's move ahead. Let's move ahead with other symptoms. So talking about that, like let's say our जब भी हमारा जो बेसिक बॉडी फंक्शनैलिटी है वो आपको चेंज होने में दिखेंगे. लाइक लेट्स से सम समथिंग मेंशन्ड हियर आर frequent urination, feeling thirsty, and feeling hungry, and extreme fatigue, like थकावट का जो हमने बात किया, ये this happens basically because our body is made to consume the sugar levels and provide energy to our cells. But जब प्री डायबिटिक कंडीशन होता है तो बॉडी इज नॉट एबल टू absorb that sugars due to few condition like insulin resistance, or sometimes body fails to make that much of insulins. That is that is the what I say, like that is the fuel for converting the glucose to energy. After that,
Right.
you can some symptoms that are mentioned are cut and worries, or you can आपको लगेगा like you are having wounds frequently and it is not getting like वो ठीक नहीं हो रहा टाइम पे. आफ्टर
Mhm.
दैट लाइक लेट्स से वेट लूज का हमने बात किया. तो बेसिकली व्हाट हैपन दैट सेल्स ग्लूकोज अब्जॉर्ब नहीं कर पाता है, एंड that like basically that energy like calorie deficiency due to that like less glucose in our body, like absorption of less glucose. So that causes like that is also a symptom. So we have to be vigilant and watch out. Anything you want to add, Rajiv?
No, I think we have introduced pre-diabetes in a very good context, and let's go on to the next slide. Probably we'll look into
Yeah, so
the other
basically like
aspect of the.
जैसे हम लोग बोला लाइक दिस इज द प्रॉब्लम ऑफ आवर बिजी लाइफस्टाइल दैट वी फेल टू मेंटेन द गुड लाइफस्टाइल. लाइक we are the patient, but we also fail, like because of our jobs, our studies, our goals. We fail to maintain balanced diet, exercise and sometimes taking medicines also. So that need not to be neglected, and like go ahead and like understand your condition and act accordingly.
Yeah. So this is one of the main causes of pre-diabetes, that is insulin resistance. So now what exactly insulin resistance is? Basically your body is not able to handle excess carbohydrates. It does not mean that your pancreas has gone bad. Your pancreas is actually working fine. It's just that there is too much of carbohydrate in your body, and the pancreas is producing the insulin, but the cells are restricting themselves. Why this is happening is because you're eating too much of carbohydrates. You keep on eating. There is no gap. You're not resting your body from the foods that you eat. Like say for example, in the morning you eat breakfast at 8 o'clock, and then at 10 o'clock again you eat something. Then 12 o'clock lunch, 3 o'clock something. So every 2 hours you keep on eating. What will happen? The body is doing its job. It is creating insulin. It is producing insulin. What it is supposed to do, but unfortunately, what goes inside is not is getting digested, and it's like it's 24 hours. Your body is in. You have put your body into work. And at the same time, some people they also have the habit of drinking, smoking, and unhealthy habits. That adds up to the more complexity of the body. And you're not exercising, as Deepak said. You have a sedentary lifestyle. You go to the office, you sit in the chair for 8 hours, 9 hours, whatever work you're doing. There is no movement in your body. You go home, you eat, and you sleep. Then again, next day you go back to office. So sedentary lifestyle, such kind of a lifestyle, honestly, it gives rise to insulin resistance. So this slide actually talks about right from eating food to weight gain. So this is how you gain your weight. So, so any
Yeah,
foods that you're eating which causes weight gain is not good. Um, yes, Deepak,
yes,
you want to-
yeah, like I wanted to add, like let's say whenever like in our Indian context, like we eat a lot of carbohydrates. We हम केयर नहीं करते लाइक हमारा पोर्शन साइज क्या है. कुछ अच्छा लगा तो हम ज़्यादा खा लिए. देन बैलेंस डाइट, लाइक वी फेल टू मेंटेन अ बैलेंस डाइट ऑफनली. लाइक लेट्स से बस दाल चावल सब्जी खा लिया, लाइक रोटी सब्जी खा लिया. बट बेसिकली इंसुलिन रेजिस्टेंस आता कहाँ से? लाइक वी ईट लॉट ऑफ कार्बोहाइड्रेट. लाइक we have to maintain a balanced diet. We need to maintain our plate size and portion size. But like Indian diet ऐसा है that we have to take we take more carbohydrates in general. So that causes more like more carbohydrates apart from other nutrients like protein and fibers, and that lead to like that lead to insulin, that like that is the cause of insulin resistance mostly. So if we maintain good diet from beginning, like let's say you know that someone is having diabetes in your family, or you are leading a lifestyle which is sedentary. So uh, you have sedentary lifestyle plus more eating more of the carbohydrates, so that will add to lead insulin resistance. So to cure this, like we have to address at our food level also, and yeah, like changing our lifestyles, like adding more exercise and other things. Apart from that, if insulin resistance is there, so how we will identify that our body is having insulin resistance. So like let's say आपके जो स्किन के कॉर्नर्स है, let's say the neck area, you will that will be more, like more dark, seems to like that will be seem more dark than your other skin complexion, so that is a one sign of insulin resistance. So we have a question from Suresh. He says that doctor advise you to eat every 2 hours. So what is your take on that, Rajiv?
Um, Yes, doctors advise to eat every 2 hours. Now what happens is that if you're going to eat every 2 hours, you're not giving rest to your body. You're taking medicines, but you should allow that medicine to be, come into effect. If you're going to eat again, then again you're going to get into the cycle of, digestion and all those, metabolic factors. So I would suggest that if you want to eat, yes, you can eat. So that when you're eating, one thing is that you are not allowing your body to get into a low blood sugar levels. One is that. Second thing is if you're eating, make sure you don't eat a very high carb food. Which will actually bring you back to the state where you were before, to a state before having your medicines. So you need to make sure that whatever you eat, it is filling to your body. You're quenching your hunger and thirst. At the same time, you are not raising your blood sugar levels. So they need to be in control.
Yes, so basically, like let's say doctors advise that because blood sugar keep fluctuating. So for diabetes, like it is advised to eat every 2 hours. Like let's say if you will go to any doctor, so they will provide you will start eating by 7, then after 2 hours take a have something at 7 a.m. Then after 2 hours have some snacks, then have breakfast at 11. So that is suitable, but but it depends on the base individual wise. Like if you will go through the researches, so you will see that people are following one meal a day omad diet. After that they are preferring lchf diet. So this is another area of controlling the diabetes. So my like I will tell that do whatever is best for you, but
Right.
you have to figure out that how it suits for your body.
Yeah. Let's move on to the other sections of you know presentation. We were probably we can let's talk about something like what happens when your blood sugar is not controlled. This is one of the blood sugar is such a thing. I mean, after your salt and sugar are the two main ingredients of your which actually fuels our body. And blood sugar is something which provides energy. So if when you have if you don't have energy, you feel lethargic, and one can actually faint. So sugar is important to keep our brain active. And so what happens if you have excess, anything excess, like say for example, if you keep on eating chocolates, your teeth will go bad, and you will have a stomach upset and all those things. So anything of excess is not good. First thing is that. So what happens if your blood sugar is very high and you always keep it at a high level? So these things will happen to you. First is you will start having your brain will not function properly. The first thing actually starts happening is that your nerves and your eyes and your heart and your kidneys. These are the four main things which actually first affects you very badly. The nerves, especially people who are actually diabetic, and since a very long time, they would already know from their experiences that the sensation of itching and pains in their nerves and the feet going numb. So these are and especially heart. Now heart is something like I guess Deepak will be able to give us more info on the heart part.
Yeah, like let's say diabetes is there. So I thank you for adding that. Since like glucose will be a fuel to your body, and if your diabetes like sugar level will be high, then none of your organs, like let's say eyes, brain, teeth, nerves, heart and kidneys, whatever basic organs mentioned here will stop functioning. So basically Rajiv has explained about teeth and breath and eyes. So like let's say for eyes you will get blurry vision, and teeth, your teeth enamel will be damaged, and uh, it will be come out like टूट के वो बाहर आएगा. Then brain, you will feel that you will get tired easily, since your brain is also not getting required glucose, and you can feel like brain fogs and all due to that diabetes. आपको लगेगा कि आप कुछ भूल रहे हो. Then for heart, let's say since heart like hearts and nerves are there, so उनका बेसिक फंक्शन है कि आपका हर एवरी ऑर्गन को ब्लड फ्लो अच्छे से पहुंचाना, राइट. बट ड्यू टू डायबिटीज योर sugar levels, some nerves get damaged because of the because of what cholesterol and all, like cholesterol gets into your nerves, and it makes blood flow slowly. So that need to be taken care of. We have information regarding that. Like we have something called LDL and HDL that need to be monitored. And apart from that, kidneys function is to filter out your sugar level and toxins from your body. So अगर आपका sugar level बढ़ा रहेगा तो body will like किडनी विल नॉट वर्क इफिशिएंटली, एंड जो वाटर आपका फिल्टर आउट होना चाहिए वो बॉडी में रिटेन कर सकता है, and it can cause swelling and other complications like skin complications. So apart
Right.
before moving that, we have question from Gracie, that should we take medicine before or after food intake. Thank you that Rohan has answered that it should be taken before meals, but I will suggest that whatever your doctor suggests, like don't experiment. एवरी मेडिसिन हैज़ इट्स ओन वर्किंग. सो अगर आपके डॉक्टर आपको खाने से पहले रिकमेंड करते हैं, सो यू शुड टेक इट एट दैट टाइम, एंड खाने के बाद अगर रिकमेंडेड है तो यू कैन टेक अराउंड दैट टाइम. So yeah, these workshops are important, but apart from that, we have to go with along with our doctor's advice also, so that you will be at better health and better, like you can manage your diabetes in a
Yep.
better way. Yeah. Going to the next slide. So this basically talks about the ranges of sugar level in normal person and pre-diabetic and diabetic. So I'll request Rajiv to
Yeah,
make
sure.
works to the
Thanks.
slide here.
Thank you, Deepak. So this slide, what we are looking into is basically the blood sugar levels for a normal person and a pre-diabetic person. And then we have the stage of diabetic and very high and dangerous. So very high and dangerous are those ones which where we don't take medicines or it's completely out of control. So what happens is that for a normal person, now how the unit of measurement is basically mg slash dl deciliter, and there is an also mmol which is basically a UK standard. So but globally we follow it is mg milligrams slash deciliter is what's being followed. So, how do we know that a person is diabetic? Or maybe how do we actually, firstly, how do we know that what are his blood sugar levels? So, there are three stages of identifying the blood sugar level. First is on an empty stomach in the morning. So, after you have your dinner, there should be minimum of 8 hours of gap between your dinner and the moment you wake up in the morning. The moment you wake up in the morning after half an hour or maybe 1 hour time, you can, you when you go to a laboratory or maybe you have a glucometer or a device which is used to check the blood glucose level. When you take a sample of your blood, you will come to know it will give you a reading of, some value. It will give you basically a number. Now that number, if it is in the range of 70 to 100, that means you are normal, you are not pre-diabetic. Everything is good for you. You can enjoy life. And then if your if that number is ranging between 100 to 125, then that means you are pre-diabetic. So that is something, it's an alarming, and you have to, start taking action. And it's like a big caution sign, and, alarming sign for you, and so on and so forth. So these are the ranges, which has been defined by the worldwide global standards and associations. So the next thing is postprandial. Now, what is postprandial? Postprandial is something like, once you have your food, when you eat your food, like lunch or maybe a heavy breakfast, after 2 hours, it takes around 2 hours for the body to digest. So after 2 hours, you will again check your blood sugar. So then, whatever number you get, you just need to match with this table, reference table, and if it and then you would get an idea of at what range your blood sugar level is, whether it is normal or pre-diabetes or diabetes. So these are the two main gold standard for checking your blood sugar. And lastly, the third is your HbA1c. Now, what is HbA1c? HbA1c is basically a 3 months average of your blood sugar levels. So this is a gold standard testing for all the doctors which who follow. And when a doctor, normally for a pre-diabetic person who has been recently detected, or he is going to check your blood sugar, doctor will actually ask for these three tests first. That is your fasting, postprandial, and HbA1c. Now, based on this, then he will order some few more tests. If based on the symptoms, and maybe if you're not feeling well or whatever symptoms you tell your doctor you're exhibiting, and then based on those symptoms, your doctor will advise further tests. But these are the three basic tests every doctor or every diabetologist or endocrinologist will suggest or advise you to take. And so this is for a normal individual who is about 20 years, and there are ranges for people, for children, and as well. We are not getting into that because children are something, those are unfortunately those poor children are like a juvenile detected diabetes. So and then we have so this is for a pre-diabetic. This is like people who are aged about 20 years. Then you have pre-diabetic, or gestational diabetes, which is a different aspect of diabetes altogether, which is for pregnant women, and that is also actually temporary. It's not permanent, because once a woman gets pregnant and due to her complications during when she conceives, if she happens to develop a pre-diabetes, or or maybe we call it a gestational diabetes, those can be actually taken care. So that is why we included this data into this slide. So this is how the blood sugar levels of pre-diabetes and for a pregnant woman would be. Over to you, Deepak.
Yeah, so like this chart that you mentioned, that I will refer that audience can take it from that, like take it from our group description. These files are mentioned there, or you can refer to like diabetes association, like American Diabetes Association or Indian Diabetes Association, to understand these better. So you will have an idea about the numbers and these terms. Rajiv has explained it good, like fasting, like postprandial, HbA1c. So like these are the terms. So basically, let's say HbA1c, it gives you the 3 month of average sugar to you on test. So for better knowledge, you can refer to the group manual, or you can ask in the Blue Circle Diabetes group also. Coming to the next slide. So these slides talk about monitoring. So yeah, why monitoring is necessary. So as we know that अगर किसी इंडिविजुअल को डायबिटीज होगा तो उसके नंबर्स नॉर्मल रेंज में नहीं रहेंगे. लेट्स से इफ आर टेकिंग मेडिसिन और इंसुलिन, सो इट कैन गो डाउन बिलो 70, और समटाइम्स इफ लाइक लेट्स से आपने मॉनिटरिंग नहीं किया एंड यू ईट समथिंग, इट विल गो अराउंड लाइक लेट्स से कुछ दिन के लिए आपने मॉनिटरिंग नहीं किया, 1 वीक और 1 मंथ, सो आपका ब्लड शुगर अबव 300 भी जा सकता है. सो मॉनिटरिंग इज इम्पॉर्टेंट बिकॉज इट विल हेल्प यू टू नो दैट आपका करंट लेवल क्या है एंड हाउ टू कंट्रोल दैट. सो it will come to you by practice, like let's say if if blood glucose suddenly comes low, so it is advised to take some chocolates and all. Similarly, if you feel high blood sugar, which is basically called hyper, like it is written in the slide, hyperglycemia and hypoglycemia. So basically, hypo refers to the numbers below 70, and hyperglycemia refers to the like more than 200 or 250. Like I have to confirm that, but regular monitoring helps on that, and also it can help you to decide what to eat, and like how much medication to take to control yourself. So let's say in the slide, like we have mentioned that you can take your numbers by CGM. Basically, that is a device which you can attach your body, and with the help of that and the related application, it will give you the blood glucose of your body. Like for the 14 days period, it is attached to your body. Like it is a basically wearable device. Apart from that, you can take your numbers from regular blood glucose monitors device and laboratories. And yeah, like when to take the blood glucose. So basically we take three sample, like it is doctor's advice to have three samples, as Rajiv has explained earlier. One one before your food, one after 2 hour of food, then random glucose. Like it will help to check that how like what is the level of your glucose in your body at a random level. So taking the monitoring, like monitoring is important basically because it will help कि आपको कौन सा medication चाहिए, कौन सा food चाहिए, क्या avoid करना है. So this is the like main one of the main role in controlling your diabetes. Anything you want to add, Rajiv?
Yes, I just want to add one part is that if when we are talking about accuracy of the blood sugar level, the most accurate reading you will get is from the laboratory first. Second would be a glucometer, and third is your CGM. Now, why CGM is at the third? Because CGM doesn't draw blood from your body. It relies on the interstitial fluid, and then it gauges what the blood sugar level would be. So there would be so that is why CGM is a bit less accurate. But yes, it does give you, there is a plus and minus of 10 to 15 units between glucometer and CGM. But the most accurate is your laboratory. And secondly, I would like to add is that the time and range. Now, the time and range is something very, very important, when it comes to maintaining and monitoring your blood sugar, because time and range will uh, help that person to come out of any complication that person is going through. Say, for example, the person is experiencing kidney issues, or maybe neuropathy issues, or nerve issues, or maybe the person has a lot of cholesterol in his body, and if because his blood sugars were very, very high, uncontrolled. And so if that person maintains a time and range of something, say between 170 to 140, this is a very recommended range of maintaining, or maybe at least near close to 140 as far as possible. Then as time goes, the person will start healing automatically, and all the complications would evade eventually. So yeah, and also workout. Now, what happens is that generally when we go for exercise, maybe walking or jogging or swimming or cycling, or maybe when we go to the gym, we do some kind of weight, we lift the weights. What happens? Your body starts pumping a lot of blood. The heart starts pumping a lot of blood into your body. So at that time, generally the sugars level can go high. Nothing to worry about it. But what you can do is that before going for the workout, you can just do a normal check of what your blood sugar levels are, and after your workout, maybe after 30 minutes of workout, you can do a check again. So this you will come to know how effective your workout has been, and then you can adjust your intensity of the workout accordingly. What say you, Deepak?
Yeah, so I only consider about monitoring your glucose level, but आपने ऐड किया एक्सरसाइज के लिए भी इम्पोर्टेंट है. And yes, yeah, and apart from that you mentioned about the accuracy. So जो ग्लूकोमीटर और लैब के हैं, तो we can calibrate it according to our use, so that anyone will be like anyone will be considering that one if he will be monitored. So these are small things to consider before taking your glucose level. So,
Right.
question from Suresh is that can you throw light on taking apple cider vinegar? So, yes, so I will. I have that information. So, let's say we take carbohydrate, so it goes to our body और वो तुरंत डाइजेस्ट हो जाता है. बट टेकिंग एप्पल सीडर विनेगर, सो ये कार्बोहाइड्रेट्स को स्लोली डाइजेस्ट करने में हेल्प करता है. तो वो स्लोली डाइजेस्ट होगा और वो शुगर आपका लेट से वो जैसे तुरंत बढ़ जाता है. लाइक आपने फूड खाया एंड शुगर लेवल आफ्टर डाइजेशन ऑफ कार्बोहाइड्रेट it can go up to 220, but apple cider vinegar will do like it will help in your metabolism of digesting carbohydrate, and वो शुगर लेवल को स्लोली इंक्रीज करेगा जो आपके ऑर्गन्स या फिर लाइक आपके डायबिटीज को इफेक्ट ना करे. सो दैट इज द use of that is why apple cider vinegar is promoted. Let's come to the next slide. Oh, yeah, so spikes and bumps, like
Yep. Uh,
yeah, we have discussed most of the it कब spike होगा कब like let's say you eat something like something that is not suitable to take in, like let's say ice cream or pizzas, that can cause spikes if you if you miss something. Apart from that, we have mentioned dawn effect and smogel effect. So dawn phenomenon is basically like your sugar is in control, but whenever you wake up, like the morning sugar level is high, so that is known as dawn phenomena. So to reduce that, like you have to you can take certain measures like taking a walk before your dinner, and like eating your dinner before before 7 p.m., so that can help. Another thing is another thing in the list is Samagal effect that Rajiv, if you want to explain.
yes, the Somogi effect is something like, you're taking medicines in the night before your dinner. And say, for example, that medicine is not enough to control, or maybe, the medicine is not enough to control your blood sugar, or maybe the effect wears off. So, so what happens is that maybe the medicine has too much of power, or the effect is wearing off. So at that time, what happens is that, or maybe the food that you've eaten, like आपने थोड़ा ज्यादा ही कम कार्बोहाइड्रेट वाला फूड खा लिया, या फिर आपने ऐसा कुछ फूड खा लिया कि वो पूरे रात तक आपको बाद में एट द मिडल ऑफ द नाइट यू माइट स्टार्ट एक्सपीरियंसिंग अ बिट ऑफ स्ट्रेंज फीलिंग. तो दिस इज सोमोगी इफेक्ट, जहाँ पे क्या होता है कि आपका ग्लूकोज लेवल जो है स्टार्ट्स फॉलिंग डाउन. So when this happens, what happens is that the person would have a disturbed sleep. The person would actually get up, and sometimes the person might start feeling, uh, nausea feeling, or maybe it's a very different kind of feeling. It's not, it's very different from hypoglycemia or hyperglycemia. It's so movie effect is similar to hypoglycemia. So that is when this kind of an effect is normally experienced by people suffering, or people with T1, or basically type 1 diabetics, or LADA, or MODY. So these people normally go through, especially T1s have experience. They are the best person to actually share more light on this, but they experience a lot of somogi effect, and so this is sometimes where what can we do to actually overcome this somogi effect, because now somogi effect and dawn phenomenon are actually linked. Now what will happen is that in the somogi effect, when your blood glucose goes down, say if it is falling below 70, you need to eat something. Especially you can eat, the best thing to eat is a glucose tablet, so which you can get it on a medical store. It's basically a chota sa tablet which you can keep it. So whenever you are experiencing a low glucose level, you eat one tablet, wait for 15 minutes, check your blood glucose whether it comes to the range of between 70 and 100. If it does not, you just keep repeating that cycle, and you also allow some breaks of 15-20 minutes between each of the consumption. So once you attain a level of 70 to 100, you stop over there. But then what happens is that again when you go off to sleep in the night, then when you wake up in the morning, you see that okay, my sugar level is high. How come? Because what is happening is that in the morning your brain is triggering the liver to actually excrete some levels of hormone which is called as glucagon. What happens is that when this glucagon it comes into the body or into the bloodstream, it becomes into a glucose, which is actually fueling. It's basically providing some kind of a energy and strength to your body to, now I've woken up. Okay, let me get on to work. So
Yeah.
this is a very common thing. It's nothing to worry about. But there are some precautions one can take to avoid dawn phenomenon and Somogi effect. Somogi effect can be avoided by correcting your medicinal dosage and make sure you are eating a very balanced diet and make sure you don't never go to sleep in a hunger state. So that is not good. You are eating medicine and you are also feeling hungry and you are not
Mm.
eating enough food, so that is not a good thing. That will actually get into your low glucose level. And for
Mm.
dawn phenomenon, the best thing is to have your dinner before sunset or sometime before 8 o'clock, 8 in the evening, and you hit your bed say after 2 hours of eating. So normally it is not advised that the moment you have your food, within half an hour चलो अभी सो जाते हैं ऐसा नहीं होना चाहिए. You must allow at least 2 hours of gap between your dinner and your bedtime. So these are the two things, and I guess Deepak would like to add some few more
No, you
points
added.
on.
Thank you. So, like dawn phenomenon and Sumogi effect, we will remember from now. Apart from that, like हमें like hyperglycemia or hyperglycemia, like we have to take care of that. Like if we are going into hypo or hyper, so that uh, care can be given to us. So Gracie is asking that if we can upload this slide to group. So we will try to upload in the document section of the group. You can refer it. Going to the next slide. So it is basically about the blood test we are recommended. So uh, if anybody is risk at diabetes or we will go to doctor and these symptoms occur, so doctors subscribe these tests in which like we have talked about fasting, postprandial and HB1C. Apart from that, C peptide test is there. So like diabetes happens because of either of the lack of insulin or because of like our inability of our body to make insulin. So C peptide basically tests if our body is producing enough insulin or not. Then insulin resistance is calculated that if we have insulin resistance or not. Apart from that, like apart from the blood test for sugar, so since it affects our let's say heart and kidney and thyroid profile, so these tests are mentioned. So like कि बढ़े हुए शुगर ने लाइक किडनी और हार्ट और थायराइड को अफेक्ट किया है या फिर एनीथिंग नीडेड अपार्ट फ्रॉम sugar medication to control these organs and balance our things. So these one like these tests will help us to get diagnose our condition and other things. So coming to the next, as we mentioned earlier also, that diet plays an important role. So basically we are learning from our childhood that हमें healthy diet like healthy and balanced diet healthy and balanced diet लेना चाहिए, right? So a low carbohydrate, like our diet should be low carbohydrate, low calorie. If you are in a diabetic range, low carbohydrate diet means the portion size should be like less in carbohydrates. Other things like fats, proteins should be included. Apart from that, protein, like let's say we can take supplements of protein also by if like Indian diet has less protein in day-to-day food, so you can work with your doctor or your like nutritionist to decide अगर आपको if you have to take protein from outside or not. And then also, yeah, fiber You have to take fiber in food. It help in digestion and keeping the like digestive system good. Apart from that, general practices are there, like avoid oily foods, like trans fat food having trans fat, then spicy foods, like yeah, like a healthy diet is need for everyone, but we neglect it because of various reasons. But if you are in suspect of pre-diabetes or you want to have a healthy regime, so you have to come back to diet and keep it according to your health. I'm correct, Raju, right?
Yes, absolutely correct, Deep.
Yes. So going to the next slide. So how to remediate reverse. We started our conversation with pre-diabetes and we gave up the information. So let's say if you are in that bracket that you have pre-diabetes, so how you are going to control it and how you are going to take your health back. So I will request Rajiv to go through it.
Yes, thank you, Deepak. So the now the million dollar question for pre-diabetes is whether can it be remediated or do we call it as remission or reversal? Yes, it is possible to remediate and remit this chronic condition if detected early and if that person acts at a very early stage. Because if that person doesn't take any kind of an action, then it is too late, and then it cannot be avoided. So for the so how can this chronic condition be reversed? So the first thing is that I always have believe is that anything that happens to you or anything which you're getting involved in, you need to have good information and knowledge of that thing. So now since you are talking about diabetes and since you say for example अगर आपको बुखार आता है, you're not feeling well, you're sick and you're having fever. Obviously, you would want to know what is the reason for getting into the state of fever or cold and cough. I mean, blindly, you would never take any medicine, right? So the same goes with diabetes. I would like to know what exactly diabetes is, each and every, I mean, I just want to know the A to Z of diabetes. So the first thing I would advise that person is to educate themselves about this chronic condition. And then the next thing is how to get the first step is to get that chronic disease under control. Now in order to get that thing under control, that person would have to take medications. Now medication in the sense this is we are talking about allopathic medicines and not ayurvedic or some baba ki jadi booty, to be very honest, because that never works, because allopathy has been proven and since generations of generations this has been the whole and soul savior of human life. So medications come in two forms, insulin and tablets. Based on the how the condition is worse, doctor might recommend insulin or maybe tablets which can be easily controlled and the person would feel much more better. Then the third thing is diet. Now, from the whole secular point of view of remitting the disease and reversing the disease, diet plays a very very major part over here because whatever we eat is actually is going to directly affect the organs of our body. So uh, why I'm saying is this because you are not going to of course exercise and movement also plays a very important role, but 24/7 you are not going to exercise because you cannot, then how are you going to survive and live? So in order to survive you need to eat, and what you eat is going to come out of it is going to give you that result. So so you need to, so these are the things that you can avoid and what you need to have. So I mean, diet is an area of topic where we can have hours and hours of discussion, and it's an endless topic. But in just to to give you a gist about what in the short form, we should be avoiding all unnecessary refined foods, which is basically we should have be eating foods which are good in nutrition, which will give you good nutritional value and which will actually help you to stay healthy and fit. Avoid all the other foods which are not going to give you not giving you any kind of nutritional value because they are just weight. They are just going to give you increase your blood sugar levels. They are going to spoil the organs of your body, and you are not going to gain anything out of it. So I guess Deepak can speak more on exercise and other parts aspects.
Yes, so like we try to educate our audience on the pre-diabetes since हम लोग बचपन से पढ़े like prevention is better than cure. So we try to present these points to you so that like it will help you to understand more about the condition and like it's also said that a stitch in time saves nine. So by our information we tried to like radiate this information to the group or anybody will seeking this information later on the group, so this will be present and this will definitely help in out. So basically like due to hectic lifestyle or anything, like let's say lots of competition in any field, education, we fail to maintain our healthy lifestyle. But like from we are shifting to new times where like health is given more importance. And yeah, so our motto was to educate our audience to take help of your condition and look to your day to day routines, food habits, and maintain it so that you can like you can be healthy for a longer duration and you can stop yourself before catching diabetes. So next slide contains some tips. So it is basically like for all, not related to diabetic only. So let's say BMI. So everyone us know that healthy BMI range is 90 to 25. So maintaining those is a very good for all, like, is a very good health benefit for all. Then sugar levels, अगर आपके नॉर्मल है तो ठीक है, अगर नहीं है like let's say if you're going on hypoglycemia or hyperglycemia, so take your medicine seriously, exercise seriously, take your insulin day by day, so that can be like that can be helpful to you. And after that you can set your food goals, like how much carbs you have to take, how much protein you have to take, how much calories you have to take. So you have to work with your nutritionist, or you can use apps like Healthify Me app, or many apps are there that that tracks your calorie. Like if you are eating let's say roti and roti and pulses, so you can add them into your app and it will give you that how much calorie you are taking from that, right? And apart from that like yeah, like you should know your condition, like how diabetes can damage you and how you can control that. So these things will keep you healthy in a longer run. And diabetes nowadays like is a lifestyle disease, and India is becoming the capital of that diabetes. So if you are a diabetic or if you're a new diabetic and worrying about yourself, so remove that worry from your mind, because stress also add to your glucose numbers. And yeah, that will definitely help you. So we have question about chia seeds and flax seeds, Rajiv. So okay, I think you have answered that. Yeah, that
Yep.
those are flax seeds. I have read that like they have good fat contents and it can help you with your heart health. And chia seeds has fibers that will help in your digestive issue and keeping your stomach correct. Like if you're taking metformin or any medicine, so those side effects are that they cause like diarrhea kind of things. So yeah, like thank you Rajiv for sharing the session. And if you have any tips from, like if you want to
Yeah,
share any tips to the audience.
I just sorry, Deepak, I just want to add just one more point is that we missed out on speaking about intermittent fasting, which is the new cake in the market. Now,
Yeah.
intermittent fasting is something like where you don't eat food and you give your body a rest so that the beta cells in your pancreas, they can actually self heal. And in fact, when you do intermittent fasting, you are reducing insulin resistance and thereby increasing insulin sensitivity. Now, when I sensitivity, I mean that whatever food you eat, once your insulin resistance is reduced, so your body doesn't have to generate a lot of insulin, to convert or probably use the carbohydrates into and convert it into energy into your body. So intermittent fasting is a game changer nowadays, and many type 2, especially people suffering from type 2 diabetic and pre-diabetes, it's very helpful, and it helps you maintain a very good blood sugar levels and HbA1c. So, and this is a very important and strong tool for pre-diabetic people with pre-diabetes. And just one more thing I would like to highlight is that lastly is that there's something called as a diabetes plate method, which we missed out in highlighting, especially in the diet section. And this applies for all the types of diabetics. In fact, is that when we are eating food, we need to take a plate which is 9 inch in diameter, and you divide that plate into 50-50, and so the first 50 would have a lot of vegetables. So vegetables is like the source of everything, because human body is designed to eat a lot of vegetables. So we eat, so 50% of your plate should be vegetables. Then the next 25% should be carbohydrates, which can be roti, chapati, which is the staple food of our Indian diet. And then the next 25% can be proteins. Now, proteins can be dal, or maybe if the person is vegetarian, he or she can have eggs or chicken or fish. So, like, of course, fish is a very nutritional, adds a great amount of nutritional value because of the fatty acid that it has. So this is how normally every person should be eating their food. And so if you see, since we talked about low carbohydrate, it is just 25% of your entire 70 from the 100% you are eating carbohydrate. Thereby, you are actually maintaining a very good health, because too much of carbohydrate is actually not enough. It's not like, अगर if I आज मैंने अगर 6 चपाती या 4 चपाती खाया तो मुझे भूख लगेगी, नहीं ऐसा नहीं. अगर आप 2 चपाती खाओ और दो दो बहुत सारा वेजिटेबल्स भी खा लो, तो आई मीन इट्स लाइक you are already full. So that is
Yeah,
how one
fiber
should be eating.
contents are there and it keeps you
Yep,
full.
yep, absolutely.
Yeah,
So that is
so
what I want to add. Yeah. Over to you,
yeah,
Deepak.
like if anyone wants to ask question, we are live, we can answer that. And yeah, like we are getting good comments from Rohan, Hansa, and then Suresh that session was insightful. So I will take that. I will thank that for the organizers like Nupur and team, that Blue Circle workshop, that we come live every Sunday at this time, and we try to educate our audience, and we are patient led community, that we are actually suffering from the disease and how we are controlling that, and we are trying to impart whatever we have learned from that. So today, I guess like I know that you have learned lots of things from Rajiv, and I also try to share my knowledge. And if you want to catch up on these sessions, you can catch up every Sunday. And whoever is watching this recording, you can put your queries in the group. We will happy to answer. Apart from that, we have Blue Circle on social medias, like let's say on Facebook, Twitter, and other platforms. So you can follow us. So we are looking for the questions. If not, can we end the session, Rajiv?
Yes, yes. We are open to any sort of questions. Please feel free to ask. Um,
Yes. So I guess no questions are there. So I request audience to join our group, Facebook group, or any or us on our app is also there on iOS platform and Android platform. So you can join us and connect with the fellow
yep.
people and get your query answered. Till
And
then,
see you guys next week another workshop from Blue Circle team.
yes. Till then, thank you.
Bye bye.
We are ending this.